thank you for joining the conversation, how museum can still be inclusive after COVID-19. I'm Aurélia Fleury, Director of Tactile Studio Canada, and I'm very pleased to present you today this webinar. I would like to begin by acknowledging that the land from which I gather is located on unceded territory of the Kanien'kehá:ka Nation. We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples within the Montreal community. So this webinar will be a 45 to 50 minutes conference, and then 10 to 15 minutes Q&A. If you have any question, you can use the chat on YouTube. And I would like to introduce to Alexandra and Marie, who work for Tactile Studio, and they will be online to ensure the chat. And Joanne is on offline. It's the community manager. He will be tweeting this webinar on capital W webinar, capital T, capital S, if you want to follow. If you have any trouble, you can also contact us on info@tactilestudio.co, and we'll be pleased to try to answer any question. The webinar will be recorded on YouTube, and we will send also the link after that. We'll send also all the resources we speak today. If you want to share any guidelines, best practices, or good references you have, please feel free to do so. So the goal of this webinar today is to give international insights on sharing inspiration and good practices regarding the relation between museum and visitors and their programming. And to build this conversation, we are very pleased to host today Patricia Riguera, Head of Education at the Department of Modern Art in Buenos Aires, Argentina. Josée Duhaime, Director of Mediation and Visitor Experience at the National Museum of Fine Art of Quebec in Canada. Regina Cosenza from Germany. She's Head of Bauhaus Agent and Project Manager at the Klassik Stiftung Weimar, and Philippe Moreau, CEO and founder of Tactile Studio. And to begin, we would like to, we break down the webinar in 4 parts, highlighting the challenges and introducing each institution, showing also the strategies and innovative solution, and finally some best practices. So Patricia, could you introduce the Museo de Arte Moderno de Buenos Aires?
Thank you so much. Yes, our museum is located in the city of Buenos Aires in Argentina. It's a 60-year-old museum. It's funded. It has 9% of funds coming from the city of Buenos Aires, and a 10 and 10 between, depending on the year, 10-15% of private funding from private donors, sponsors, and we also have international donors with base in New York City. If you want to move the slide to the next one. Our museum is one of the largest public museums in Buenos Aires. It has 118 square feet or 11,000 square meters. It receives about 270,000 visitors a year, with 54,000 participating in education programs. Last year, we had about 45 community outreach programs. Some were one-time or two-time activities, and more annual programs. In the next slide, you can see a picture of the entrance of our museum. We have automatic doors and a ramp this museum was renovated in 2018. It has 4 floors. We have 4 accessible elevators, accessible restrooms, accessible lockers, and 2020, our main objective was to turn it into a fully 100% accessible museum. Before COVID hit us, we are in winter here in Argentina, so our museum is closed. So most of our challenges had to do with our digital and virtual programs. If you want to move to the next slide.
Sure.
Thank you. We had to move all our content to digital and virtual DEAI programs. We focused on the social, emotional, and cultural role of the museum, how to reach audiences with limited access to technology. 5% families in the city of Buenos Aires don't have access except a mobile phone, and about 10–15% of the country also. How to reach partner organizations and determine best practices for each of these DEAI groups. How to reach special schools through our Ministry of Education. Argentina has a very wide amount of public schools. Some of them cover special needs for children, schools for the blind and schools for the deaf. So that was part of our challenge. Establishing a museum hygiene, safety, and accessibility measures for reopening. For this, we created a net within Argentina with the 4 most important museums to develop one protocol for all museums. And then, as part of our 2020 objective, we had to install wheelchair elevator and tactile maps for the reopening.
Okay, so a lot of challenges were already there, and
a lot of challenges,
and a new one with
yes,
facing the COVID. And
it was some of the programs that we had before. Our main concern: how do we keep on working with those programs, and how do we transfer our cultural role to families? Creating a new experience, most important experience to cater for the social emotional need, because we have had very long lockdown. We've been locked down since mid-March, and how to provide help for teachers that were in the midst of their school year.
Yeah, and you're still in lockdown in Argentina, so.
Yes, we are still planning possible opening for September the 1st. That's
a good news. And crossing the Atlantic, Regina, could you tell us a bit about how it happened? Because in Germany, you're already reopened.
Yeah, you can go to the next slide. Yeah, yes, our institution is based in Weimar and has more than 25 museums, palaces, a library, an archive, little historic houses, and historical parks. So these are really different houses, museums, and they are in different COVID status. Also, some are recently open, some are open, and we start to provide even small group tours, no open group tours, but small booked group tours. And on the following questions, I will focus on the museums of modern, like the Bauhaus Museum. Maybe you can show the next slide. These are new museums. We opened recently in 2019, 1 year ago. So where we have different workshop areas with do-it-yourself and the design focus. We have a lot of group, especially school groups, who normally book project days with workshops, and we have multi-sensual stations in the exhibitions. So in the lockdown, we faced a huge number of group cancellations. And since the reopening, we try to provide our guests an interactive and communicative, but of course, a safe visit. So these are our main challenges: to provide a good visit, a communicative and accessible visit, but a safe one for all the visitors.
Okay, thank you. Thank you, Regina. And thank you all the participants to join on YouTube. We are more than 130 people following this webinar. Thank you, and apologize again for the trouble connecting. Josée, could you tell us a bit about Canada and Quebec?
Yes, so I'm bringing you to Quebec City. So with I work for the Quebec National Museum of Fine Arts, which is about, well, Quebec is 250 kilometers from Montreal, just to give you a little bit of an idea. We are government funded as well, and we opened in the 1933, which is quite a number of years from now. And I'm going to go on, since we only have a short amount of time, we'll skip to the next one. You saw numbers there, so it gives you an idea. Our mission is to reveal and promote and conserve the Quebec's work of art, from ancient art to art now. And in October 2018, we actually have a new director coming in, Jean-Luc Moreau, and we really put an emphasis on to bring the museum to be a little bit more accessible, welcoming and inclusive to all. We did have an accessible program, which basically was to give free access to everyone. But now we want to go a little bit further than that and see what hinders visitors to come in when you have limitations. So right now it is really to promote arts in the lives of everyone. If I go to the next one. So what we want to make sure is to provide resources and efforts to reach all those excluded from the cultural experience. One of the ways to do this for us is to really reinforce the ties with all of the community organizations that surrounds the museum. The next one. So in the past year, because I've been at the museum only for a year, which is last June 2019. So in the past year, we've actually developed special programs for young adults dealing with mental health issues, homelessness, schizophrenia. We did have a new immigrants arrival because of Justin Trudeau Prime Minister's policy. So welcoming them not only for the history of Quebec, but also for the arts and artists. We developed programs for women dealing with breast cancers. We're actually working with Tactile Studio to develop the first tactile path in the museum. And one thing that is really interesting for us as well is the impact of art in everyone's lives is also being used with doctors to bring back a little bit more humanity in their practices. So we're developing a training programs with doctors to go a little bit further in this. In the past year, we were actually going to start a research project to determine the limits of our institution, and because of the closing down of our institution, we weren't able to go further than that. But we're hoping to see it evolve a little bit more now that we are reopened. So our challenges with the closing down and the reopening, with all of the procedures that we have to put in place, was to maintain our relationship with our community partners, because we cannot have a lot of activities inside of the museum. And that we still feel that art is very important. We do want to propose cultural activities, nonetheless. So, and you will see further on what we decided to do. And we are continuing the development of the tactile path with Tactile studio, but being closed brings some difficulties. So those are our main challenges at the moment.
Yeah, thank you, José. I see that in different institutions, there were already programs and projects who have been a bit stopped by the situation. And one of the challenges also to maintain the link even during this moment of closing museum, maintaining it with visitors, but as well with partners and volunteers and staff as well. That was the main challenges from the Fine Art Museum. Philippe, can you give us a bit of insight for Tactile
Hi,
Studio?
everyone. So yes, we are a Tactile Studio, an inclusive. We are inclusive designers. We are, in fact, an agency, of course, but also a workshop. Some of us are really producing objects, and well, we are present in Paris, Berlin, and Montreal. Our headquarters are in Paris, in fact, and our clients are in the Western world, can we say, plus Middle East and Arabic Peninsula also. So, well, as a matter of fact, well, you can go to the. I need to accelerate a little bit, maybe. So, this is not that much, Aurélia, please.
Sorry.
Thank you. Just to have a brief idea of what we are making, what we are designing. We are designing some kind of strange hybrid interactive objects, which is talking with a screen, or of course we have some architectural models, or even interpretative trails, talking device, etc. So as you see, and it's of course very obvious with our name, Tactile Studio is very tactile and haptic movement and gestures. So what it does mean that we have this last month a huge, well, not issue, but a problematic with hygiene, and well, some of the museums or even the audience, well, we were really expecting on what can be done during this COVID period with a sense of touch, because, well, in the idea of when you look aside, you can imagine that it can be more complex to touch in a public space. So you can go on, Aurélia. Well, this is some kind of our clients, as I said, where we are in fact in the working for museum that I think has nearly the most suffer from COVID. I mean, Europe plus United States are one of the countries that suffers the most. So, well, we are in the front line in that case. We were really, as designers, we are really expecting, well, what can be next, in fact. So we were intensive readers of a study which came from a research and development agency, which is called Impacts. I highly advise everyone to have a look to their studies. It's absolutely great. And well, they ask nearly each week a question to their audience is what can you make feel safe again in a museum? And the answer are quite interesting. I will not be too long on that subject. I highly advise again to have a look to their website. But well, I think that there are some three main ideas that we can understand from their study. the first news is not a very good news. It's, well, they are mostly expecting something that, well, will not depend on the museum action or even our actions. I mean, people will save again when, well, not very surprisingly, the vaccine will be available, or when government access restriction will be lifted. So, but some are more good news, because we can have and produce some answers with museums. Of course, they are really expecting mandatory face coverings. They are really expecting some, well, the availability of a hand sanitizer. And moreover, of course, they are waiting for some social distancing and try to be in a museum with less people as usual. So the third idea that I want to highlight is that I think that, you know, I read nearly every week, in fact, this study, and I think that opinions are really constantly changing. For instance, we didn't really think about face coverings at the very beginning of the COVID crisis, like in mid-March or end of March. No one was expecting face coverings. Now, well, I mean, I produced this slide like 2 weeks ago. Now we have a new study from the mid-July, and it's more than 70% of the people who are expecting face coverings. So, of course, people are super linked to media and what is a global message on that, what is a general mood and ambience on that, and because everyone is speaking about face covering and masks, so now this is becoming the main subject. So, well, on my point of view, of course, this opinion will change nearly each week. We are entering, I think, in some kind of huge turbulent zone. It's going to be quite chaotic for the next months. But, well, that's, I think, an opportunity to really create and to be creative and to invent new solutions, and to be I think it's a measure of our capacity to adapt, in fact. So this is really interesting. I mean, as a designer, it's really super interesting.
Yes, thank you, Philippe. And I am glad to know and to welcome all the people who joined today. We are more than 150 people on the YouTube from 12 different countries. So welcome, everyone. We were introducing the different museum with this first question about the challenges. What we realize is that even if we have different contexts and the concerns are related to the size and step of COVID evolution in each country, there are always the willing of maintaining museum missions. And what we observe through the world is that a few recommendations are shared, like the online registration, wearing masks, as Philippe was saying just before, respecting social distancing, and creating new signage and routes for allowing secure visit in the museum. So could you share one of your strategies, Patricia, for instance, with the Modern Art Museum of Buenos Aires, to complement and to move ahead on that topic?
Yes, thank you. Well, as we are still in lockdown, we had to find a way to install and have the museum ready for our DEAI groups during the reopening. One of our challenges was to install this elevator. It was donated last week, thanks to the Friends Association of the museum. And we could install it because we have 10 necessary staff, you know, the staff that needs to protect the works of art and keep the museum clean while the museum is closed. So we were able to do that last week. And we are also working with on an organization that donated the tactile maps, Fundación Inaguadal and In Studios, who are building them, and they are ready to be installed probably in September once the museum is opened. As part of our accessibility plan, of course, we are including all hygiene measures next to the tactile map so that people can wash their hands before before touching any substances. And we are working on protocols on the tactile tour, especially our tactile tour involves works of art. So we are studying how we are going to develop that as part of our challenge.
Okay, so using this time of closing to develop and install things that you won't have.
Yes, exactly. As part of our accessible plan, we are using this time to get the museum ready. We are also working on signage of the museum so that people know what to do and what to expect. Our museum is free for all education activities, and it's just a small fee for visitors. So we are probably working on pre-ordering or online tickets too. Just most of the measures that many museums are taking. So since we are in lockdown, really, we are still working on our content. We had the advantage of having 2 weeks before the virus hit Argentina. It hit other countries, so we had that advantage of having time to plan ahead. With the direction of Victoria Norton, our director, we gathered a team of curators, educators, editorial department, exhibition department, and communication department. We meet twice a week. And what we do is we create a 2-week theme where we invite local artists, reference people that are talking about important subjects in our community. We're opening our books and catalogs to the community on our online website and all our education programs. Why local artists? Because our museum's mission has to do with empowering and being the home of Argentine artists and Latin American artists. So we decided that this strategy would also help them continue with their own art projects and giving them visibility and showing their ideas and their thoughts. This also involved our education programs. We had artists doing special illustrations and videos for the education department. With the problem of having a lot of children without access to technology, we came up with the idea of organizing certain beds, material in boxes to be distributed by the Ministry of Culture's programs to orphanage homes, homeless homes also. And we continued our special programs with partner organizations. We meet with them and we decide what's the best practice for this group. We have lots of community outreach programs that work with mental health, autism, women victims of violence, gender program, equity, the blind community, the deaf community, and senior citizens. We work a lot with the low income and vulnerable neighborhood around the city of Buenos Aires. So we had a lot of challenges and to face, and we decided that the best strategies was to approach each group specifically. And so the contact with these partner organizations was key into implementing these programs. During these 3-4 months that we've been in lockdown, we had about 4,300,000 views in our website and social medias, and about 12,000 downloads in our education section. Most of our materials are in the Ministry of Education website and the Ministry of Culture as well. And we partner with some international organizations. There's one called Aprenda en Casa, Learn at Home, which is through Latin America. And then 100.org, which shows innovations in education. So we really cared to continue working with our special visitors and their needs.
Okay, thank you. So you use this time indoor to make some change and adapt, make some adaptation, and you move the program and content on the digital with this challenge. You say before that not everyone has a free and easy access. So using the Ministry of Culture platform and different
and education
channel.
as well. Yes, our main concern was to create this new experience. We couldn't move the museum to people's homes just by a virtual tour. That would just last a week or two. So we wanted to include a new experience and to be able to use art to express emotions and feelings and work those through art, especially for families. When we talk about a program for families, we also know that families have different contexts. So we had to work with materials that they had at home because they couldn't go out to buy materials, especially art, like stationery shops and art supply shops were closed at first because it was a very strict lockdown. So our challenge was how to develop a program for them with the things that they had at home, and that included all the family.
Yeah, and speaking about a family, I guess, José, from the Fine Art Museum, you also develop a solution to make people comfortable visiting the museum.
Of course, when the museum closed down, we were quite frustrated with all of our projects that were going on and that had to be stopped. So, and on the preparation of reopening, the health agency really stated clearly that nothing was going to be able to be held inside, beside having the exhibit open and having guards and the welcoming team. We weren't able to go more than one people at a time, 2 meters apart. So our objective was how to propose something different. What could we do? And what we came up with was actually, since the museum has a 4 pavilion, it's in the heart of the Abrahams Plain, which is a vast park used immensely by our public. So why not take this opportunity to play outside for the whole summer? So what we decided to do is to call the public to what we now call the museum path, which is an invitation to rediscover the surrounding of the museum instead of being just in the exhibit. Why not go outside? So we designed paths, which is still undergoing, actually, to be really honest. We partnered with a local artist to paint on the sidewalk. We created a safe space so that people can actually recognize where they are and where they should go. And that's a call for the public to walk on the path. We created a terrace with umbrellas, table and chairs, and easy access to all kinds of visitors. And we developed a cultural programming where all activities are held outside. Therefore, we can reach visitors of all ages in need, and while respecting social distancing. The tables and umbrellas provide sort of a unity, a cell, so that you can actually have a family sit at a table. You don't have to separate them. And so if you're a family of 4, you have a table, but if you're alone, you're at a table as well and you're separated. So it's fine. And the activities we developed actually are a little bit more to the senses. So we have a dancing at the Garden of Sculptures. So the dancers use the sculptures to inspire their movement. We're doing the same thing with yoga, where the movements proposed to the visitors are actually used, inspired by the artwork. We developed a walk around the pavilions, accessible for all, wheelchairs, family, children, senior citizens. We decided the path so that everyone could join in. We have an improvisation night on some of the most notorious Quebec artists or artwork. And I did mention family program as well, artistic activities, storytelling. So instead of just abandoning programming, cultural offer, we really wanted to be able to play with our visitors this summer, not cut completely the link with them. As for our community partners, most of them are actually closed during the summer, but we decided to call on them as well because as we found out, most of everything is closed in the city. So anyone having limitation was left alone at home. So as we called them, they said, yes, if you're having something, we'll be there for sure. So we decided to also open early mornings on Tuesday and also offer any other time if we're told ahead of time, so that let's say on a regular time before COVID, Frida Kahlo, our actual exhibit, would help 200 people per hour. COVID time is 80. And for any community organization having special needs, we also brought it down to 40 people an hour, so that if they're stress related, if there is sickness related, so they don't have to deal with this as they come into the exhibits. And we also offer all of our activities outside for them, differently organized and arranged so that they can actually have an offer through the summer. So that was our initiative this year.
Wow, thank you, and congratulations also to quickly move and build new program for this summer to allow people to be able to enjoy the museum. I know that summer in Quebec is quite short, so it's I'm sure a visitor will appreciate to have this time. And it's interesting, as you said, that the signage and visual information to help people to understand the new rules are important, and that can be done in a design way. You speak about table and umbrella and signage on the floor, so that's really interesting measure to make it also a new space with those new rules. And those program with emotional implication, with movement, working with artists on the field of experiencing the art, the sculpture with the body or with the stories. It's very interesting. I guess we can be inspired by those examples. And what about the realization in Germany, Regina?
Yeah, I want to show you some examples what we tried in the lockdown time. When we were in the total lockdown and all the museums were closed, we already planned some activities, for example, for the Easter holidays. So normally we focus on different day activities for schools or community centers. And so before the lockdown, we already planned the Easter holidays together with a community center in Weimar, the Kinderhaus, which provides activities for children in families with in a different or in a difficult economic situation. So these are families which normally don't go on holidays. So we plan every year activities in the holidays. And this year, yeah, nobody was on holidays. Everybody was locked at home. So we changed our program in a digital way, but in a combination between digital and analog work. So we called it The Bauhaus Comes at Your Home. And we packed 30 packages with material, analog material, which the children were needed in the workshop, and we sent it to the children at their home, and we held online YouTube videos, workshops with our educators. The kids were looking the videos, were able to ask questions, and every day they shared their results through WhatsApp, and we shared the results from the children through our social media channels like Instagram or Facebook. So the children got a big audience for their art pieces, and we had the possibility to do the workshop not only online with digital media, but also the children could do something in their home together at the same time, but separated from each other in a safe way. And this was quite successful, and all the children were really happy. So after that, we were thinking about this way to communicate and to do workshops in a digital way. I will talk about that afterwards. And now I want to show you another example. Yeah, when we opened, we already planned an interactive projection in the Bauhaus Museum. So it doesn't has to do with COVID, but it's still a good example because it's an interactive way for our visitors. We did it with the artist collective Denkigami and in a collaborative process with the regional school before COVID. And however, it provides visitors in a ticket-free zone of the Bauhaus Museum a playful way to approach the idea of the Bauhaus stage with a tracking system. In the room, the visitors are giving traces to the projection, and it works without touching anything, just to go in the space and in the area. And the other example is in the Museum New Weimar on the right. And we recently try out to give visitors some fingertips to touch the tactile stations like architectural models. This works really good for especially together with the app, with our app Bauhaus Plus, which provides audio tours with audio description and audio tours in easy language. So this is a way we still can provide a good accessibility in the museum. Yeah.
Okay, so you don't provide entire gloves, but just fingertips, plastic protection or fingertip protection. Okay, that's interesting.
Yeah, and they are based at the station, and you can use this, or you shouldn't touch the stations. Yeah.
Okay. Thank you, Regina. And Philippe, what about Tactile Studio strategies?
Yeah, you know, we are we are designers, so we are pragmatic, not that intellectual. So, well, we nearly the beginning of the crisis, we really realized that we have some kind of new habits, new gestures, new movements. And well, and everyone noticed that when you enter in a shop, can you go on the next slide, please, Aurélia?
Sure.
When you go in a shop or in malls or in restaurants, something that was really quite new is that you of course you use a hand sanitizer. Moreover, when you just pay or you just buy some food or etc. So it was like a new gesture, a new habit from the audience that we need to take that in consideration, mainly because the tactile objects that we produce are generally, in fact, inclined. It's between 15 and 25%. It's an inclined plan. So we need, in fact, to design a new way because a standard vertical hand sanitizer will not work. We need to try to develop a small design idea that you have a hand sanitizer that will fit to nearly all degrees of inclination, plus that you can fix very easily. But you don't need any tools to install, just in order to make it simple for museums, in fact. So, well, I think you can go on the next slide, just to have a look to what we designed. In fact, it's a kind of a balancelle, we call that in France. In French, it's you can move the dispenser and you can fix it with some kind of adjustable screw very easily. So that was our first answer, because we've noticed that it was a so common new gesture that we need to try to adapt this new gesture to our tactile displays. Moreover, in fact, a bit after that, we also consider that, well, the fragrance that you smell when you use this kind of dispenser are really super hygienic. It makes you feel about hospital, it makes you feel about disease. Well, it's not that welcoming in a place. So we try to understand if it was possible to develop some new fragrance with, of course, the necessity of killing bacteria and viruses on your hand. But just to be sure that we can do that, is it possible to have some kind of a new fragrance that maybe can help people to be also in a new sensorial environment? I mean, we are in a museum where everybody everything is really strictly there is a great graphic layout. Even the chairs are chosen. Why do we have this kind of hospital fragrance at the entrance? Moreover, we have a lot of constraints here in France because this kind of a product are fixed by the law. It's fixed by degrees, so it can cost more than 8 euros per liter. So, well, we develop, in fact, with Carol Calvez, an olfactive designer, a new fragrance that maybe can be more welcoming in a place. So, but also having that in mind, we think that it maybe can also be a good creative approach to develop for a museum its own fragrance, its own way of seeing olfactive to have the olfactive sense. So, well, after that, we also remark that, the cleaning devices or cleaning procedures were really super asked by the client. So we decided also to come with a little cheap kit to clean all these tactile objects. Of course, maybe you can have a look to the next page, Aurélia. Some kind of simple procedure to clean it out with good, and we spent some time to discuss with our outsource manufacturer of cleaning solution, cleaning lotions. So we settled a procedure that can help killing bacteria and viruses on nearly every surfaces. I think that it's also something that maybe you should communicate to the audience to say, well, here we of course have in mind that your safety is important, and we spend some time cleaning not only, of course, tactile objects, but also screens, for instance, that are super highly manipulated.
Yeah, the British Columbia Museum Association edit also a guideline and about cleaning procedure. That was interesting, that they highlight the fact that they usually cleaning procedure are usually done when museums are closed. And they recommend to change the hours to make this during the day, during the visitors' presence, to make them feel safer. So that's really interesting thing. And I would also just remember all the participants that you can share some question on the chat. Alexandra and Mary will answer you and give us also the feedback for the Q&A later in few minutes. I just wanted before that to pass through some innovative solution. And again, we can go back to South America. And Patricia, could you speak a bit about your innovative solution?
Yes, since we are still in lockdown, one of our first strategies was how to reach our ASD program for children and teens. This group of teens and children usually come in the morning when the museum is closed, and they have all the galleries to themselves, and then they move on to our educational room to do an activity. So we decided to focus on one work of art and set up a few suggestions for families to work with them. They can download the work of art. In this case, this is a work of art by Leon Ferrari. And they can paint it online or analogically. And then our design team, in-house designers, designed this set of vocabulary cards for families to download, print, or work online. If you move to the next one, we have an example. In this one, we are dealing with emotions, how works of art can express emotions with colors and shapes. And these are the cards for them to work on how they feel during this lockdown. As part of our innovation also, we are now in winter holidays and we have all the children and families in lockdown. So we moved to live workshops. We created about 5 or 6 workshops for these 2-week holidays, in which they're free, could register, and we partner with these artists for them to give the workshops, and they're working quite well. And another innovation that we had was to work directly with teachers and students, because schools were open for 4 months. So we created these teacher training sessions for teachers, for museum professionals, and anyone interested in learning about art and education. And another program we have is called El Museo a la Escuela, Museum Goes to School. So what we do is we have meetings with teachers and students to work directly with them and our works of art from the collection. So trying to innovate and reach our audiences. Another innovation that we are dealing with is our senior citizen program. Senior citizens are high-risk population. We have lots of public senior homes in Argentina. These are people that need special care, need to be cared for by nurses and doctors, and they don't have the money to pay for private residency, so they live in public senior citizens' homes. And we created this program because we have senior citizen residents around the museum block. It's just around the block. We started working with them like 3 years ago. And now in the virtual necessity, we moved the program to all the residences in the city of Buenos Aires. This program includes our conversations done by our senior citizen volunteers. We have a group of 8 senior citizens that do virtual tours gather tours at the museum. Now they're doing the virtual conversations. And we created a booklet, a monthly booklet that they can download, meditations, podcasts, and workshops to support these senior citizens and their well-being. Many cannot see their grandchildren or their families, quite isolated, and COVID has hit senior homes a lot. So we were deeply concerned about this age group, and we came up with all these activities for them to do. And it's really, I'm really proud of my team. I have two members in the community outreach team, and with this situation, we enlarged it to 3, and they're doing all these activities with a limited budget. So I'm really happy and proud of them.
Okay, thank you, Regina, for those insights and those innovative programs. It's really amazing to see how this particular situation really push everyone to find new solution and to adapt, and that's really great. Regina, from a German perspective, I know you also have a cool, innovative solution to share.
Yeah, I already talked about the Easter holiday workshop with the kids of Kinderhaus, and after that we were thinking that's a cool idea to do digital workshops, because until now all our workshop rooms are closed, and so we managed to have a digital workshop for all our audience. And it's a 2-minute workshop, which we launch every Friday. Every Friday, there's a new theme and a new challenge with materials everybody has at home. So this works really well through Instagram and Facebook of our institution. And since April, we quite have like an archive of little digital workshops. And we communicate these workshops, for example, as well. We communicated it to schools in lockdown, so the teachers had the possibility to do little design challenges for the students at home, because all they had to do is to find things at home to do these challenges, and they were connected to the time of Bauhaus. And yeah, and we also didn't need money for this thing, because our educational staff, normally they are working with our audience in the museum, and now they are doing this digital workshops. They are doing the concepts and they are speaking to the audience online. And because it's not a live model, we also do English description in the video, so it works internationally as well.
Okay.
And another thing we provide is on the next slide. Because yeah, we have a lot of historical houses where, for example, Goethe and Schiller lived 200 years ago. We thought about digital offer, stay at home with, because everybody has to stay at home for 3 months. So we did digital live guided tours at the house of Goethe, of Schiller and co. And we always announced it 1 week before the theme and the house, so the audience could ask questions before and live on Instagram. And my dear colleagues, Kirsten and Felix, always guided through the houses, and they responded live to the interest of the audience, or they could prepare when they when the audience had special interests before. So it was a good way to connect to the audience and to think about their interests and to talk about the everyday life like 200 years ago.
Great. And was a participant many to follow those visits?
Yeah, live it was more than normally in our public tours in the museum live, but we also always, it's a live format in Instagram. You see it on the slide, but we also use it for YouTube to watch it after that. The like the media quality is not really professional, but it's not the idea to do it like in this professional way. It's just it's an idea to connect with the audience. So we provide it afterwards on our YouTube channel always. Yeah, and then the audience is even bigger. And there are some people, they are going online every week.
So you are maybe having new visitors who will discover passion for your institution. Great, thank you. And Josée, about innovative solution in Quebec.
Well, I guess what I more want to talk about is adaptation or adaptability that we need to really play with this COVID time. As we closed the museum, we were just to start a research project with Laval University. It aimed to identify what hinders the visitors with limitations to come to the museum. So we have partnered with an organization called Social Participation Inclusive City, which is actually to be able for anyone having limitations to participate to any kind of activities offered in the city. And we also partnered with a second one working with handicapped people. And we were to hold a session at the museum with participants, scholars, organizations, and so on. They would tour the whole museum, and we would hear comments and recommendations. And obviously, all of this was stopped as we closed. Now, partly reopened, we decided to go ahead with the research and not wait for everything to be back to normal, since we do not know what the new normality might be, and if it will ever happen. So we decided to make contact with everyone, gave an update on our new reality, which actually changes every 2 days or so, and we will start from there and adapt as we go along. Our decision on this is to move on with this changing reality, but keep in mind our main goal, the accessibility to all, even in COVID's time, knowing that most of the people living with limitations at this time are left with practically nothing. So we really wanted to move ahead and as quickly as we could. And on the same trail of thought, we did the same thing with the tactile path that I talked about a little earlier, that we are doing with you actually. Even in the closing period, we actually went ahead with the planning, even though it is slowed down. And the testing should be done mid-August, I believe. And we will have Purell, and the group test will be there with social distancing and so on. So when we really have the possibility to set them up and open the exhibit hall, then they are going to be put in place and ready to be used. probably with a Purell dispenser on the side, as you just showed. But I think that even though everything is closed right now, or a lot of it, and even though everything starts slowly, we need to move on and hope that, not hope, I think believe that everything will be back differently, but back on place anyhow. And we need to adapt with this changing time.
Yes, thank you, José, because I think this, what you just said, answer one question from Bart Vermander, sorry for the pronunciation, which is accessible officer of the city of Ghent in Belgium. And he says working on program, accessibility program. And he was wondering that what was doing blind people, what offer for blind people in this time of COVID, and because all the museums have a tendency of just avoiding the touch and interactive interfaces. So it's interesting to see that there are some museums who want to try and to adjust, but not cutting everything. And as
and I think there will be place for discussion, but I think it needs to be there, and if we don't want to cut visually impaired people to the joy of art, then we need to go ahead with this and push it further.
Yeah, and Patricia, Regina, sorry, said show that also with this little finger for plastic fingertip to touch. Patricia from in Argentina, I guess you also are looking for developing small groups for touch tour under supervision and cleaning process.
Yes, but we developed also a program for blind people during lockdown. I have some slides that I can show, that you can show.
Yeah, I have just I am receiving a lot of the different questions we have now around this topic. So Nadia Abraham is curious to know if museums who keep tactile and touch interactive have provided extra signage or language for visitors along the line of touch at your own risk, or some of the space now when you enter you need to sign that I am aware of the risk I can have there. José, I don't know if you have a...
Well, at the moment, most of the tactile interactives were closed down, to be really honest. That's why, but we regular compute iPad things. So one of the reasons why I want to go ahead with the tactile board that we are developing with you is I think that it goes further as far as discovering an art piece. And there will probably be additional signage. I would assume so, but the group test will tell us how far we need to go with this.
And I don't think that some kind of a sentence like "touch at your own risk" is a good message, in fact, to send to the people. It's really frank.
It's under.
So, I mean, well, we are not that well. The best COVID response is wear a mask. In fact, you can touch things. We are totally missing the point. I think touching is not risky if you wear a mask and if you don't put your fingers in your mouth. So, I mean, you can touch a thing, then wash it. This disease is not through your skin or something like this. It's more complicated than that. So. Of course, touching is well. We spent some time, in museum last weeks in Paris. We spent a lot of time in museums, just to be sure of what other people are enjoying the museum in this period. And we've seen a lot of people touching things, a lot. I mean, even in Orsay, it was quite surprising because they reopened an exhibition, and it was all about discovering some kind of strange monsters. And we have this experiment, which you really have to put your hands through some kind of black box and touch a thing. And we were like, whoa, this is, well, on our point of view, we were sure that no one is touching anything anymore. And in fact, it's not the case at all. People touch everything, in fact, because they wear a mask first, so they feel safe. And then, well, usually we have some kind of 2 or 3 hand sanitizer around the place. So,
They're
well,
everywhere.
in fact, I think people need to touch, and will still need to touch. So it's on our side to find some solution to make it safer, or clean it frequently, or propose some hand sanitizer, etc.
Definitely,
yeah.
Definitely that the designer role and museum role to find and to innovate in that terms, and we have a role in that to decide whether institutions are going to be like 19th century institution without touching everything, or if we're following the 21st century museum and finding new solution with maybe new technology, as a lot of things are moving to digital. And in that topic, I guess, Philippe, you can maybe share this innovative solution.
Yeah, yes, of course. But just in order to conclude, I think that what is my feeling is that there is maybe some kind of gap between the audience expectancies and well, they are really ready to go back to normal. In fact, the audience, but mainly I think that in museum people are a bit afraid of letting them do things because they are afraid of, well, put someone in danger, or, and of course there are sometimes, particularly in France or in Europe, some kind of administrative huge structure which with really not risk think. So I think, well, there is a great distance, I think, between the management of the risk and, well, the risk that people are, I mean, we are taking subways, we are touching, you know, the bars in the subway, which is really not super clean, and we are doing that nearly every day, and we feel safe because we wear a mask. What is really different in a museum, I don't see. But, well, on our side, we try to develop, because we have some partners in Germany that explain us that they have some kind of new technologies that can be helpful with some kind of nanoparticles. So we just begin this month a research and development phase with in fact a chemical school near Paris. Because, well, it's not a science fiction. In fact, we have this kind of nanoparticles that are really super present in the hospital, in particularly in the medical equipment. It's based on silver and copper, and while it has this kind of capacity to weaken very quickly the shell of the virus or the bacteria, and moreover, it really alters the DNA of the viruses. So between, well, it depends on the load of the varnish or the paint, we can of the load of the silver or copper in the paint itself, but it will depend between 1 minute to 10 minutes. It will nearly destroy all viruses, bacteria, and fungus on the surface of the object. So we are really trying to develop that. It already exists in some form. There exists, for instance, some wall paints based on that technology, but wall paints are very super fragile. It's not resistant enough in our field, because people, when they touch objects, they really touch a lot, and they try to scratch it, etc. So we need some kind of a super resistant paint, which is the family of polyurethane paint. So this is, well, in fact, the center of the research, how can we do a super resistant painful object, which is antiviral and antibacterial. But well, in fact, the answer will be yes, it will be possible. We don't have already the good numbers. We don't know in how many minutes the bacteria or the viruses will be destroyed. But we already know that, yes, it's possible, and yes, it can be produced in midterm. I mean, before the end of the year. So that's a great hope on our side to really, well, maybe at the end we can signal or have some kind of graphic logo, or that yes, you can touch that object. It's naturally antiviral or antibacterial.
Okay, thank you, Philippe, and thank you, everyone, all the panelists, for being here today. We are finalizing this webinar. I know that you were on the chat with a lot of different questions. Do not hesitate to share any resources or new question you have. We will send you a synthesis of the webinar as well as the link of the recording. And we will try to go back to a few of the questions we had in the chat. We didn't get the chance to answer today. Thank you, Regina, Patricia, José, and Philippe. Thank you, Mary, Alexandra, and Joanne for the backup. And thank you all the participants to be here with us today. It has been a great pleasure. Feel free also to send us an email if you want us to develop new webinar. We had a survey on the Zoom platform, but as we moved on YouTube, we don't have it anymore. But we will be glad to have any insights on the topic you would like us to develop further. Thank you, everyone. And bye-bye.
Thank you.
Thank you.
Thank you, everyone.
Thank you.
Thank you.